Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys and answer all your burn and urine and plastic surgery questions, and of course go over very, very important topics. And today we have a really important one here in Florida. But before that, I just gotta say, I missed you guys. Not sure if you missed me, but yeah, it's been about 2 weeks since our last live. I was out of town, actually out of the country. So, you know, it's the first one coming back, and I'm super excited about that. All right, so today we are going to talk about a new laws that are here in Florida, which actually came into effect July 1st, okay? So these laws have been in effect since July 1st, and these are actual laws, meaning that this is a bill that was voted on in the Florida House of Representatives and in the Senate, okay? And what we're going to talk about here today is what's called House Bill 1471. And this bill, like I just said, was voted unanimously in the House of Representatives and in the Florida Senate, and therefore became law on July 1st, 2023. All right, and this bill there's a lot to it really, but there's a few things that are important and have to do with what we do here and what is done a lot here in South Florida and, you know, in plastic surgery offices throughout the state. And that is that it has several laws that relate to a specific procedure, which is the BBL, right? The Brazilian butt lift, or otherwise known as liposuction with gluteal fat transfer. Okay, and so today I want to go over some of the highlights and kind of summarize the law, okay, and how, you know, things are going to affect, you know, how it's going to affect things here in South Florida, and how it may affect us here at Pure Plastic Surgery. Okay, so let's start from the top. So, like I said, these things that I've written down here pertain to specifically to BBLs, and this is what the law is about. The law is actually specifically about BBLs, not really about other plastic surgery procedures like a mommy makeover, tummy tuck, etc., etc. So specifically to BBLs, one of the first things it says is that an in-person examination of the patient must be conducted no later than the day before surgery, and it has to be with the surgeon and the patient both physically in the room, okay? Meaning that it cannot be done via video, it cannot be done virtual, it can't be just, you know, submitting your photos or whatnot. You have to see the person, okay, no later than the day before surgeries. Now, what if you saw the patient, say 2 weeks ago, 1 month ago, 6 months ago, that's okay, right? It can be any time before that. But what cannot happen is that it cannot be the first time that you're meeting the patient face to face the day of surgery. That cannot happen, okay? So that's law number one, and this is affecting many other centers out there because, you know, they typically were meeting the patients the day of surgery. And so now we're getting all these, like, you know, rumors and stories about patients getting canceled, about some of these high volume centers asking for extra money so that you can keep your date. Okay, that's odd. And why do y'all think that is? Well, because they were doing, you know, single surgeons were doing 8, 10, 12, 15 cases in a day. Okay, and you know, that can no longer fly. You can't meet the patient the day of surgery. You got to meet them at least the day before. Okay. How does that affect us here at Pure Plastic Surgery? No effect, right? We always meet our patients the day before surgery. That's what's been established here for the past 5 years. Perhaps there was a rare exception here or there. Now we can't even make a rare exception. If you lose your flight, you're going to have to postpone your date. But really has no effect on us. We've been doing this all along. Check. All right. The next one is that any duty that is, you know, is going to be given to a surgical assistant or someone else at the time of surgery that's going to be delegated has to be done under the direct supervision of the surgeon, meaning the surgeon has to be in the room at all times when you're getting a BBL. All right. Once again, this is obviously something that we've always done here. Our surgical assistants are great. You know, we've always done all the critical portions of the case. And anything else, we're there in the room with them. So for us here at Pure Plastic Surgery, again, no change, check. Okay? Next, the gluteal, when performing the BBL, the gluteal fat extraction and fat injection has to be performed by the surgeon, all right? Of course, we're the ones that should be actually injecting the fat. And of course, we should be doing that under ultrasound guidance, which is coming up right now. So yes, the surgeon must be doing the fat injections themselves. They can't be delegating that portion of the procedure, okay? Once again, this was already basically a rule here in Florida, but now it's actually a law. But once again, we've been talking about this for many, many years now, that the fat can only be placed in that safe space, which is that subcutaneous space between the skin and the muscle, okay? So the fat's only being placed there, and that is a safe space, so another check. Now, ultrasound use, what I've been talking about, preaching for years, ever since I started using the ultrasound, September 2019. Okay, I've done the most ultrasound guided BBLs in the nation, basically. And I've been talking about this and how it makes the procedure safer. Well, finally, okay, what I've been talking about is now a law, meaning that any surgeon in Florida doing a BBL must use ultrasound guidance during that procedure, okay, by law. Check, okay? Not only that, but we're actually a training center here. So a lot of you have probably seen our WAGS ultrasound guided gluteal fat transfer training. We've done multiple of these trainings. We've done somewhere between 6 and 8 already, trained over 30 surgeons. And we're actually a training facility. Basically, we have the most experience here. So now you're going to have all these surgeons, just starting to learn how to use the ultrasound, not really having experience on how to do it. They're just starting right now. They're just catching up to what we've been doing here at Pure Plastic Surgery for the past 5 years. But now it's mandatory and everyone must use it. Okay? And then last but not least, they say that when you're doing a BBL, you shouldn't be doing anything else. Well, of course, right? You're performing surgery. So you can't be running like 2 or 3 different rooms at a time. You can't be, doing anything else. You got to be there performing your BBL. So these are the new laws, the new rules, and it's gonna cause a lot of changes for many of many centers here in Florida, many of those high volume centers. That's why you're getting, a lot of people are getting the calls like, oh, we're gonna have to postpone your date, we're gonna have to cancel your surgery. Oh, if you want to keep your date, you're gonna have to pay more money. And why do you think that is? Well, because of this, okay, and then this, and then this. Anyone who's out there, doing 10, 12, 15 surgeries, 15 BBLs in a day, okay, they're not gonna be able to do that anymore. Okay, you can't really, be running multiple rooms at one time. All right. So that's why you're getting your calls. But guess what? Guess how many patients are getting calls here at Pure Plastic Surgery? 0. Okay, why? Well, you see all the checks, right? We've already been doing all this. We've been doing this pretty much since inception, all right? Certainly since I started using the ultrasounds, so we must say that. So since the ultrasound, I started using that in September of 2019, okay? So I've been preaching safety. Those have been following me for years and years. I've been preaching safety for years. I've been talking about how to make this procedure safer. I've been talking about using the ultrasound. I've been talking about all these things. And just now, July 2023, everyone else is catching up. Okay? But we've been doing it for years. We have the most experience in doing all this, and certainly the most experience using the ultrasound. All right? So big news. And I'm happy to take any questions regarding this or anything else, any other plastic surgery topic you may want to discuss.
First of all, do you do in-person consultation? If I want a private one?
Yeah, of course. So, here's the thing. What we typically say, in order to just kind of get your information in, we need some, like your name, your cell phone number, your email, etc. One of the easiest things to do is to go to our website, to hit on that little button that says virtual consultation, and just fill out the questionnaire and, fill out the form, send in your photos, and then our coordinator will call you. But when the coordinator calls you, she'll be happy to set up that in-person consultation. Okay. Otherwise, there's a short form on the website as well, which just asks for like your name, or, kind of contact information, and we'll be able to reach you through there as well. Our coordinators are very knowledgeable; they'll be happy to facilitate it, and they'll make sure you get that in-person consultation. So, in summary, we have 3 forms of consultation. Okay, we have your in-person consultation, we have your video consult, and then we have your virtual consultation where you're sending your questionnaire and your photos.
How does the government regulate that doctors actually follow the law?
Well, right, that's going to be the next step, right? So, first they got to create the law, and then they got to follow up with that. So this is then what happens is that this law then needs to be basically taken in by the Florida Board of Medicine and the Florida Department of Health, okay? And the Florida Board of Medicine and Department of Health, they have inspectors, okay? Basically people that they send out to the clinics to make sure that everybody's in compliance. And they can do these inspections, they can do them one of 2 ways. One of them, they can be announced, and where you you have like a set date, they're coming in, etc. Or they can be what's called unannounced, basically a surprise visit. So between these 2 types of visits, it is their responsibility to go out and make sure that everybody's in compliance.
This is a comment and says, "Wow, you look great, Dr. Earl. The weight loss has you looking very youthful."
Oh, well, thank you. Yes, I'm sure that person knows, and for the rest of you out there, so I've been on a weight loss journey. I'm on the medication, the semaglutide, or the what do they call it? The brand name's Ozempic, but the generic name is semaglutide, and I've been on that for 5 weeks.
4 or 5?
Yeah, about 4 or 5 weeks. It's actually, honestly, it's worked out great. I've lost over 15 pounds already, halfway to my goal. So another 15 to go and we'll be all set.
Okay, let's keep with the questions.
Okay.
Body type versus J plasma. It's the same?
So they're very, very similar in the sense of the type of energy that they use and the indication, right? So body tight and J plasma, they're both being used to aid with skin tightening. It is something that we can add at the time of liposuction, basically. And there are some very popular areas are, for example, the arms, the thighs, and the chin. Both the J plasma and the body tight use what's called RF or radio frequency type energy. Okay. However, the way that they kind of transmit the energy, okay, and the device itself is different. The J plasma actually uses a certain gas with it in order to transmit that type of energy. And the body type, it's more like a unit, an electrical type unit, okay, if you will. I like the body type. It's what I use here. What I like about the body type is that it has a feedback mechanism that allows you to know just what the temperature is. And if the temperature gets too hot, it shuts off automatically, decreasing the risk of potential, complications, burns, and things of that nature. So that's why I really, really like the body type. And it has multiple probes that you can use for the different areas. So little tiny probes for like eyelids, to like a medium probe for the chin, to larger probes for, like, say, the abdomen or the arms. So I really like the versatility that it has. Plus, the machine also has the Morpheus in it, which is awesome. That's something that we can do here in the clinic. Again, that's RF or radio frequency microneedling to help with a lot of the skin tightening as well. So I really, really love that machine. And that's why we are the #1 body type clinic in Florida, right here at Pure Plastic Surgery.
Okay. This is a good one. Just 1 second, it moved. Any suggestions for patients with hypothyroidism?
All right, so first of all, if you have hypothyroid, you're still a candidate for surgery, okay? As long as the hypothyroid is controlled, all right? So what are we gonna need? We're gonna need 2 things. One is, of course, we're gonna need a clearance from either your primary care doctor or your endocrinologist, whoever's taking care of our hypothyroid. And we're gonna check some labs. We're gonna do what's called a thyroid panel. That's gonna have several thyroid studies and we have to make sure that all those labs are within normal range. Okay, so most hypothyroid patients are on medications. One of them is called Synthroid. So you just want to make sure that your medication is optimized, that all your lab levels are within normal limits, and that you get your clearance. And if all that checks out, you're good to go.
How long is it recommended to get breast implants? Can they be removed along with skin removal for a smaller breast implant with lift?
So how long can you have breast implants? Let me take that part first. So today we have our what's called the 5th generation silicone implants, gummy bear type implants as they're known, which means they have a highly cohesive gel. It's not like liquid, it kind of retains its shape, all right? And these implants are under warranty by the companies typically for life, meaning that you no longer have to exchange them at any set specific time, like at 10 years, 15 years, etc. If you're going, on into 10 years, 15, 20 years, and everything looks good, everything feels fine, there's no issues, there's no need to remove them, no need to exchange them. Okay?
So the other part will be this patient has implants,
Yeah.
and she asks if they can be removed with a skin removal. So I guess a tummy tuck for a smaller breast implant with lift.
Oh yeah. So can you exchange your larger implant for a smaller implant? You certainly can, but typically we have to do at least 2 things. One is we have to we're gonna have to tighten up the pocket, right? Because now you have a larger pocket to accept the larger implant. So typically we have to do something that's called a capsulorrhaphy, which means that we're tightening up that pocket for the implant. And then the second part is what you mentioned. We have to basically lift the breast back up, remove a lot of the excess skin, so that the breast then kind of flows more tightly around your new smaller implant. Okay, so yeah, it certainly can be done. It's not a problem. It's a little bit more of a challenging case, if you will, but it's not. It's something that we do pretty much every week.
If I want a tummy tuck and also a BBL, which one do I do first? Will I have enough fat for a BBL if I do the tummy first?
Yes. I like this quiz. Question comes up a lot, and I like the question. And let me explain here why. Because the second part of what you said there is a myth. It's a total myth. Okay. And I've seen, the problem why it becomes confusing is because I've seen surgeons give different answers. But let me tell you, those surgeons that at least that I know, and including myself, who have done thousands and thousands of cases, thousands and thousands of BBLs, thousands and thousands of tummy tuck, those surgeons with a lot of experience will all tell you the same thing, and that is do your tummy tuck first. Okay? Please, do your tummy tuck first. If you have loose skin, if you have diastasis, muscle separation, muscle weakness, do the tummy tuck first, okay? Why? First of all, liposuction alone is not going to deal with the skin, and it's not going to deal with the muscle separation or weakness. So if you do liposuction alone, you're still going to have that protruding belly because the muscles are still weak and they're still separated. You're still going to have that loose skin, but now it's going to look all lumpy, bumpy, wavy, uneven. Okay, it's just not going to look good at all. So you definitely want to do the tummy tuck first. What people say that if you do the tummy tuck, where am I going to get the fat? It's a myth. I have never in my career, not had enough fat because someone had a tummy tuck first. Zero chance. Okay. Remember, the only skin that we're removing is that skin kind of in that lower belly area. We still have all the fat available for the rest of the abdomen, all of the flanks and the waist, the entire back. And then if you want to add extra areas, there's always your arms and always your thighs. Okay, so it's a myth. Do not believe that myth. Okay, you will have enough fat. That's not a problem. Okay, it's never been a problem. But what is a problem is the opposite. So I've had plenty of patients that they're either afraid of the tummy tuck, they don't want to do the tummy tuck, they want to see what happens. Okay, and then they do the BBL and they're happy with, say, the booty and the hips, but they're not happy with their belly because they still have, it still protrudes, it's not flat because they have some of that muscle separation or weakness, or the skin in the belly doesn't look even. It looks lumpy, bumpy, wavy, uneven, and it's not because the lipo is uneven, it's because the skin didn't retract well because you have loose skin. Okay, and you're going to get overall a worse result. And then when you try to do a tummy tuck after your BBL, it's a lot tougher and the complication rates are higher. It's tougher because now you have scar tissue, so that skin doesn't really want to stretch down. So you have a much higher chance of needing a vertical incision at the bottom there, which you don't want, obviously. And also because you've done the lipo and you've taken up some of the blood supply, the chances of like skin necrosis and wounds opening and stuff like that is higher. So I don't recommend it, okay? So, summary, do your tummy tuck first, okay? All right.
How long I should wait for a second round BBL at TikTok?
All right, so if you're gonna be doing the second round of the same thing, so you had BBL round 1 and you're coming back for BBL round 2, you gotta wait at least 9 months, 9 months minimum, okay? Ideally up to a year, all right? You don't wanna do it sooner because if you do it sooner, there's still gonna be too much inflammation, too much scar tissue. It's gonna be a very, very difficult surgery and usually a lot more bloody, okay? Which you don't want that either, all right? So you wanna wait at least 9 months. Now, if you're doing 2 different procedures, say for example, you did a BBL and then you wanna come back and do a breast augmentation or a breast lift, okay? For that, because we're working on 2 kind of separate areas, then 3 to 4 months is enough. All right, so if you're doing 2 of the same, say Lipo 360 and Lipo 360 or BBL, whatever, you want to wait 9 to 12 months. If you're doing 2 things that are different, then you can wait 3 to 4 months.
Okay, this is just saying, I'll see you tomorrow, doctor.
All
Here at
right.
TikTok, there's a patient, connect.
All right, awesome. I'm looking forward to it.
Okay, next question is, can incisions be more hidden, especially the one on the middle back when doing Lipo 360?
Yeah, definitely. So that's one of the things that we do here. It's kind of one of our signatures. If you heard me talk about the South Beach butt lift, one of the key things about that procedure is hiding the incisions. We agree with you 100%. We're really big on trying to make these incisions as hidden, as small, and as imperceptible as possible. So when you're looking at the back, okay, and you know, please excuse my crude drawing of a back here, okay, but you know, typically we put one all the way down here, right in between the butt cheeks, and that's never going to be visible. And you know, sometimes, you know, potentially there's one there that's at the bra line. Now you can put that one right there in the middle of the bra line. If you're wearing clothes, you know, it wouldn't be visible. But if you're using like a low cut or low back cut dress or something like that, it could be visible. So we want to try to avoid that when we can. So we can actually hide them right here, right kind of in the armpit area in the back there. We can put the incisions there instead, and from there we still reach all the areas that we need to reach, okay? But the incisions are quite hidden. Now, that's the good news. The somewhat bad news is that not everyone is a candidate for this, unfortunately, right? If you're too tall, or you're too big or too wide, sometimes then we can't reach all the spots we need to reach with these incisions. So this is, you know, mostly reserved for our kind of a little bit lower BMI patients or patients that are not too tall or too big, so that we can make sure we reach all the areas we need to reach through those incisions.
Another greetings. Dr. Earl, I truly enjoy your podcast with Maddie from Big Bot. No lie.
Oh,
very
yeah.
informative.
All right, awesome. Yeah, we had a great time doing that. Hopefully we'll do some more. It was really enjoyable, and I'm glad you listened to it. And I look forward to doing more of those in the future.
Are you hunched over after a mommy makeover, or can you stand up straight after?
No, yeah. So anything that has a tummy tuck, and the mommy makeover will have your tummy tuck. You're gonna be hunched over. Okay, why? Because we're stretching that skin down. We're making it really tight. Of course, we're doing that muscle repair on the inside as well, and that's gonna just feel really tight. So at the beginning, you're gonna be walking kind of hunched over like this. Okay, and we kind of want you to do that as well because we want you to protect the area. for those first few days, okay? Now, as the days start to move along and things start to stretch out and relax a little bit, then you can start to straighten out. But that's typically sometime after the first week, usually around day 10 or so. I mean, every patient's a little bit different. But yes, do expect to be hunched over for at least a week or so.
Did you inject Sculptra? It moves, sorry. Did you inject Sculptra into your buttocks? Is that
Yes.
legal and safe? I've seen some dogs doing it lately.
Yes. So is it legal? Yes. Is it safe? Yes. Do we do it? Yes. All right. So 3 yeses. But you got to know a few things about Sculptra. Okay. First of all, where are you injecting it? Same as the BBL, right? You got to put it in that safe space, which is between the skin and the muscle. You have to put it in that subcutaneous space. Okay. Number 2. Sculptra does not last forever. That's why if we have a preference, I prefer to do the fat transfer. Sculptra will last potentially up to 2 years, and then you have to kind of repeat it again, all right? And then number 3, it's not really meant for like a full, kind of like, fully changing the shape of the buttock and hips, because it's going to require too many vials to do that, right? Typically say that for a BBL, right, we're putting in about 1,000 cc's of fat. You're not going to be able to do that with Sculptra, okay? So what it's meant for is like if you want to fill like smaller specific areas, then it works really, really well. But it's not meant to do like a full-on BBL, like, reshaping the entire buttock and hips, okay? Because it's going to get like prohibitively expensive. If you try to do that, it's going to be way more expensive than a BBL. Because just the cost of the Sculptra, the syringe itself. Okay, so what do we use it a lot for here? Say you had your BBL and and everything's great and you love it, but there's like this one little spot that just needs just a little bit more volume, and you don't want to go through a big surgery again and all that. That's where the Sculptra comes in and works really, really well. It's something you do here in the clinic. Doesn't require any sort of anesthesia. It's basically one of these lunch in and out procedures, and you're good to go with a 0 downtime.
The last one, Doug, we're almost there. What are your thoughts about the drainless tummy tuck?
So here are my thoughts, right? There's 2 ways to do a tummy tuck. You can use drains or you can do it drainless, okay? I use drains because that's my preferred method, even though I know patients, they're not fond of drains. But honestly, it's just for a very short period of time. Remember, you're doing a tummy tuck that's going to last you for many, many years, okay? So the amount of effort they have to put in to deal with drains for just a few days doesn't really compare. Why I don't, it's not my preference to do drainless. There's a few reasons. Number 1, in order to do it drainless, that means that you have to put several what are called quilting sutures inside, okay? Because you still have to close that dead space. Okay? So you got to put multiple sutures inside. And if you're not super careful with these sutures, they can cause little indents, okay? And they can cause what we call contour abnormalities. So I don't like that. The other thing is, if one of these little sutures for whatever reason gets infected, that's a nightmare. You gotta sometimes go in, open everything up, go and find an infected suture, pull it out. It's very painful for the surgeon and for the patient. Okay. And then the other thing, and this is honestly, this is on me, but it takes a lot longer. It just takes a lot more time, which means that it's more time for the patient to be under general anesthesia. And we all know that the longer that anyone is under general anesthesia, the complication rates go up. All right. So I like to keep all my surgeries to not much longer than 3 to 3.5 hours to keep complications the complication rates as low as possible. Because you guys know, once again, right? Pure safety first, right? We've been about safety first from the very beginning. I mean, those of you guys that have been listening to us for years and years and years, you know that it's not just some trend because some new law came out that we're talking about this, like all the other places are doing now, right? They're just catching up. We've been talking about this for years and years and years. And finally, everything that I've been talking about has now been validated, okay, by even the legislature of Florida, okay, to try to really do everything that needs to be done to make this procedure safe. Because you know what? A BBL does not have to be dangerous. Okay? It's only dangerous when you're doing unsafe practices. when you're putting fat in the muscle, when you don't see what you're doing, when you're running multiple rooms at the same time, when you're doing 10, 12, 15 cases in a day, okay, that's when that, tragedy happens, right? But here, as you know, I've always limited myself to 5 cases in a day. They're not all BBLs. I've limited to 3 BBLs in one day. All my focus, all my energy, because I want to give my all to that first patient and to my last patient of the day, right? Every single patient deserves my best, right? Okay? You think if you're case number 12 of the day, you're getting the best? No, you're not, right? So the BBL does not have to be a dangerous surgery. It can actually be very, very safe, and we've proven it with numbers, right? When we go to the World Association of Gluteal Surgeons, a lot of like-minded surgeons like myself, the mortality rate for a BBL there is 1 in 26,000. That's much less than even a tummy tuck, which is routinely quoted as about 1 in 14 or 15,000 mortality rate. Okay? But what are we doing there? We're doing safe practices, everything that I've been talking about, and we're using the ultrasound, which is key, right? We're making sure that we're in that safe space between the skin and the muscle, okay? That's where you want to be putting the fat, okay, not into or deep to the muscle. And with the ultrasound, you can actually see exactly what you're doing. All right? Okay. Any other questions? We're good for today?
Well, there is a patient that says that she has BMI of 21, if you can work on her.
Of course, yes. So BMI 21 is actually still within the range that we can do BBL. We typically, here at Pure, we do what we call our signature South Beach butt lift, or SO-BBL. And that's what we reserve for mostly our lower BMI patients. And the great thing about that is that we can create those beautiful curves, bring out that nice hourglass from the front, upside down heart from the back, smooth transitions, hidden incision sites that are not going to be seen, and of course everything done safely on the ultrasound guidance. All right, okay, everybody. I hope you found this useful. If you guys have any specific topics you want me to talk about, please let us know. Otherwise, I will catch you all next week on Hump Day with Dr. Alex Earl. Take care. Ciao.